Well, for years, attempted suicide has been treated as a criminal offense under Nigeria's criminal laws. But the country already has a National Mental Health Act built around dignity, treatment, protection, and psychosocial support. Now, the Federal Executive Council has approved an amendment aimed at removing criminal penalties for attempted suicide, with the proposal expected to go before the National Assembly. So what will this change actually mean for a person in crisis? Our guest has spent years advocating for suicide prevention and practical mental health support. Kunle Pelemo, mental health advocate, author of Mental Hygiene, and founder of the Empower Mental Drive Foundation, joins us. Mr. Pelemo, thank you so much for joining us on Jasiri.
Wow.
It's a pleasure to have you.
Yeah, and we're feeling the vibes and the enthusiasm. And before we got here, Mr. Pelemo would intimate us that he's a fantastic dancer. And of course, we did nominate a member of the team, to engage him in a dance-off. So it will be good for your mental health. Dancing is good.
Absolutely. We did dance this morning.
Yeah, so Mr. Pelemo, let's get right into the heart of the matter. Let's talk about this reform. What is wrong with treating maybe a suicide attempt primarily as a criminal offense, rather than a mental crisis? If Inam was here, even though I don't agree with her sometimes, I know she'll say something like, it was still an attempted murder. The person still tried to buy himself. So it's kind of premeditated, like, other criminal offenses. That's one of our colleagues' standpoint on it. So what would you say is the difference between somebody that tried to kill himself or maybe someone that killed another person? What would you say is the difference, and why should they be treated differently?
Okay. Thank you very much. And this has been some of the questions that had created a lot of debates as regards criminalizing suicide in society. And Nigeria has suffered from that for a very long time. The difference is simple. People who take their lives. And the first thing that I also want to do now is to create an awareness about change in vocabulary. Rather than saying commit suicide, it's better to say someone someone took his life or someone died by suicide. That little change in word will make people come out the more. And you see, as we are moving from the criminalization of suicide to decriminalizing it right now, it's no longer a crime. So using the word commit now, that speaks volumes in that regard. So people who take their life, they are people who actually need help, because suicide is a complex issue. But one of the major reasons why most people take their lives, I'm not saying that's the sole reason, but it has to do with mental health related issue. So how do we punish someone who needs help? And that's the difference from someone who took someone else's life, which is murder, and then someone who takes his life as a result of not being able to withstand all the pressure that he's been through, or even mental illness or ailment, so to speak. So if you go ahead to punish someone as such, then you have so many people who are going through such things and they will not come out to ask for help. And thereby we are pushing a huge number of people through suicidal thoughts and then even suicide at the end of the day.
Which leads me directly to my question, where I'm saying, so the Federal Executive Council has approved this amendment instead to remove criminal penalties, like we've established for attempted suicide, replacing it with care, and support. And it's actually expected to go before the National Assembly. Now, my question is, could decriminalisation actually encourage people to speak up sooner, or are there any other lacunas that we haven't looked at?
Yeah, I think for every law there might be lacuna in one way or the other, which is the hole people can plug into. And that could also be like the argument some people will make that now that it's been decriminalized, a lot of people might want to attempt suicide, feeling that, okay, it's no longer a crime. But the truth is, criminalizing it is wrong. and you don't right a wrong with another wrong.
Okay.
So that takes away the criminalizing suicide on its own. So now when we move forward to take the step to care for people, and I think that is where the solution lies.
Yeah.
Even though that might not offer the entire solution, but it's a very good platform to start because people will now be free to come out, to speak up as regards whatever mental health related issues they are passing through that is creating suicidal thoughts in them, suicidal ideation in them. Because one of the major reasons we have underreported cases in Africa, it's this particular reason, because they feel it's a crime. So someone took his life, the family member will say, do not even talk about it.
Yeah.
And the World Health Organization has said that countries, you know, in Africa, they have underreported cases. So we don't really even know the extent of the problem because most people don't come out to talk about it because they feel it's a crime. But now that it's been decriminalized, I think it is long overdue, but it is laudable at the same time.
Well, I said it earlier that Nigeria already has the National Mental Health Act, right? Which provides for dignity, protection, treatment of psychosocial support, and the likes. So, but there has been a huge gap, you know, between what the law says and how people have been treated. You know, just like you've always said, you also said, you know, if this amendment, you know, becomes law, what should happen differently in the first few hours after someone survives a suicide attempt? That's one question. And then who should take responsibility for the next stage? Is it the police, since we're still trying to decriminalize it? You know, is it emergency medical personnel, psychiatrists, psychologists, social workers, family members, or all of them? And what should the chain of care look like?
Okay, thank you. That's an amazing question. That's very wonderful. Because this particular Mental Health Act that we talk about, that's the 2021 Mental Health Act, has a lacuna as a result of the penal code associated, you know, with suicide. And that's what the Minister for Health, Professor Muhammad Ali Pate, was trying to figure out, how to really move from just change of law. Because when we say we decriminalize suicide, yeah, that's just the change of law, to a reform. So when it becomes a reform, and I think that's what the minister is pushing towards, it will move forward from just saying, yes, this is no longer a crime, to what do we do for an individual who had attempted suicide? And that speaks to what you asked.
The next stage.
Who are the people? Yes. What's the next stage? How do we care for those people? And I feel it's going to be a joint effort, you know, by a whole lot of people. You talk about the caregiver, you talk about the police, you talk about you know, psychologists, psychiatrists, you know, social workers, even family members as well. So it will be an all-encompassing, organized approach. And I think the government has to start this. And, you know, one of the things that I have pushed for, you know, relentlessly is including mental health in primary health care. So in hospitals, in, you know, public hospitals, public health care, there should be someone who attends to the mental health, you know, of people who come to those places. So all of these things put together, I mean, I feel is what the government should do in order to create an organized approach to, I mean, individuals, to helping individuals who have attempted suicide. All
right. I know you have actually talked about removing punishment and putting in maybe prevention. You have mentioned it in between what you said. So I don't think we should, you know, go again in that direction. So after we've been able to decriminalize, what should we put in place alongside decriminalizing? Because that's one thing. But when we remove punishment, because if we remove the punishment, but we don't improve other things that make this ideation to come to people, things like access to care, what problems have we really solved? Because you're saying, okay, it's no longer a crime, but mental health hospitals doesn't have adequate funding, doesn't have doctors, so many other things. Life is still difficult. So what are we going to put alongside it? And what next steps would you recommend that we should take once this proposal is approved? Because, you know, it's still on the table, being read, but we have to start making plans towards it that, okay, once they have made this into law, what do we need to put side by side? I'm talking about maybe the National Assembly, health authorities, state government. What should we prioritize for this legal reform to really make the difference that we expect it to make?
That's a lot. That's a lot. The first thing is funding. Government has to provide funding for mental health. And I think mental health, from what I gathered, in the budget of, you know, the health budget, mental health takes only 5% in the entire budget, and that's very low. And if you really want to move from, you know, protecting the people to also creating recovery for them, it starts from early intervention. So you even want to prevent people from attempting suicide, even though you know those cases will occur. But I think what the country needs to do is to find a holistic approach, organized approach, and which I mentioned earlier on. There will be funding, there will be massive awareness. Well, I mean, part of what we're doing speaks to that, whereby people understand that it is not weak to speak. Asking for help is not a sign of weakness. Whenever you are going through whatever mental health related issues you're having, but most importantly, how well will you be able to find help? Because there is a major gap between mental health worker and those people who are in a crisis.
Yeah.
I mean, I think it's between ratio 1 to 300,000. So for a
300?
caregiver now to 300,000 people. So you see, that's it.
Staggering. I was just going to say that we're having, you know, the death of doctors is already prevalent in other health sectors, even in hospitals. Now, if we're narrowing it down to mental health specialists, I think the ratio would even be higher. But I didn't even think it would be that high.
And to even further buttress this point, this particular statistic was gotten when the Jackpot syndrome had not been, you know, this terrible.
Wow.
So, you know, a lot of people had left and all the rest. So I'm sure it will have even reduced further in terms of the ratio of caregiver to patient, mental health patient.
Wow.
So a lot of funding needs to be done. Government needs to create like that architecture, that platform that other people can, you know, now buy into and operate within.
All right, let's take a short break here because changing the law may change how we respond after an attempt, but the prevention of suicide has to begin much earlier, sometimes with recognizing a change in someone's behavior, listening when they say they're struggling, and knowing what to do when the warning signs appear. We'll get practical after the break. How do you actually help someone who may be suicidal? We'll be right back.
All right, sadly, we need to wrap up our conversation with Mr. Pelemo now, but then we'll have him back, definitely.